For a patient considering cataract treatment, they've got to think, what is their priority? If an individual feels that they want to have a strong desire for spectacle freedom, then unfortunately that's going to be very difficult to achieve through a NHS cataract treatment program. It's much better for that individual to consider having a private consultation and a private treatment where we can have a whole range of different lens implants that become available to us, such as toric implants to correct astigmatism, such as multifocal implants to help with correcting near sight and far sight at the same time, or even extended depth of focus implants, which are very good at providing computer screen range eyesight as well as good vision for distance at the same time. So there are a whole range of implants that we can draw upon once we've had a very careful and thorough assessment of the individual's needs.